Hello, welcome to this press conference. I'm Elizabeth Thompson with CBC News. With us today, we have Minister Patty Hajdu, the Minister of Indigenous Services, Mona Fortier, who's President of the Treasury Board, Jennifer Carr, who's President of the Professional Institute of Public Service of Canada, and Leila Gillis, who is Deputy Chief Nursing Officer at Indigenous Services Canada. They will be speaking to us about increased supports for Indigenous Services Canada nurses working in remote and isolated communities. They will be making statements and will be followed by a session of questions and answers. If you would like to ask a question, please use the raised hand function. There'll be one question, one follow-up for each reporter. Minister Hajdu.
Well, thank you very much, and thanks to everybody who's joining us today. I'm really excited to be able to be here with my colleagues to talk about some good news for hardworking nurses and healthcare practitioners. Kwekwe, hello, bonjour. Today, I'm joining you from my area, which is within the Robinson-Superior Treaty Territory. I'm so blessed to live on the traditional territory of the Fort William First Nation. And of course, many Métis people have contributed to this territory over the centuries and years. So I am joined virtually today by my colleague Mona Fortier, Jennifer, who is the President of the Treasury Board, Jennifer Carr, President of the Professional Institute of the Public Service of Canada, and Leila Gillis, Deputy Chief Nursing Officer for the First Nations, Inuit and Health Branch of Indigenous Services. You know, we've been having, as you know, a very vigorous conversation about the importance of healthcare and the importance of access to healthcare in this country. And of course, with the challenges that living through a global pandemic has presented to countries around the world, Canada, like many other countries, has struggled to support those hardworking healthcare providers across the country. And in Indigenous communities, often the providers, the nurses, they are the backbone of communities. They are the people that are turned to in all kinds of situations. And oftentimes they're working in very remote and isolated communities to deliver vital healthcare services that are critical to the health and welfare of communities. And I want to start with a huge thank you, actually, to all nurses and healthcare workers across the country that have been working so hard day and night to keep people safe, not just from COVID-19, but to help people maintain and improve their health and treat conditions and chronic illnesses across the country in a time where the demands on them have been extraordinary. It's really dedication, compassion, resourcefulness, and especially in these remote communities where oftentimes there are extreme shortages of nursing, given the remote isolation of many of these posts. And so when a nurse leaves an isolated post, it not only poses staffing difficulties, but it really does threaten the health and well-being of the community. And every time there's a change of nursing staff, it can also create barriers to accessing care. I have to just compliment the nurses at Indigenous Services Canada, because not only are they providing the professional services, but they also are developing relationships and trust of the community. And so when a nurse leaves and is not able to continue to perform duties in these posts, oftentimes it really threatens the fabric of the community, and it can be very challenging to establish those therapeutic relationships again. And so the retention of people in remote communities who choose these challenging positions and serve out of dedication to community are really truly treasures for all of us to cherish. So I will say that I'm from Northern Ontario. The reality of remote communities facing challenges accessing healthcare is something that I've lived and I've certainly experienced with the many people I represent here in Northern Ontario. And as the Minister of Indigenous Services Canada, I can tell you that the further away that you get from a larger centre that has permanent clinics and permanent hospitals, the harder it is to attract people to work and stay and practice in these remote communities. And it's not just isolated to nurses, by the way. There are other challenges that remote communities face, attracting, for example, education workers, water operators, other skilled trades. And so we need to be focused on the best way that we can support communities to recruit and retain workers, and that is a complex piece of work. But it's why today I'm so excited about this announcement. And so today I'm announcing that the Government of Canada and the Professional Institute of the Public Service of Canada have reached an agreement to substantially increase the recruitment and retention allowances for Indigenous Services Canada nurses who work in remote and isolated First Nations communities. And it's really a reflection of the challenges and the deep personal commitment that it takes to serve in a community that is isolated, that many times is not accessible by road, and that requires, in some cases, prolonged stays. The allowances for nurses in these situations and in these communities will be tripled, meaning that more nurses will be better compensated for the work that they are doing every day. And the increase will come into effect on September 1st, 2022. It will continue until March 31st, 2025, or until other collective agreements are reached. The allowances will be provided to both full and part-time Indigenous Service Canada nurses who are delivering critical services in remote and isolated First Nations communities. So what does the agreement contain? The agreement provides increases of the following. So first of all, the initial recruitment allowance will be tripled, soon to be $6,750. This is up from the original recruitment allowance of $2,250. The allowance the allowance provided after 12 months of employment will also be tripled. So it will be $9,750, up from $3,250. And the annual retention allowance will be also tripled up to $16,500, up from $5,500. This agreement will apply to the 50 remote and isolated communities where Indigenous service nurses are located. There's 24 in Ontario, 21 in Manitoba, 4 in Alberta, and 1 in Quebec. Now, I know these increases don't completely address all of the pressures that nurses are facing, but I hope that this marks a step in the right direction, and more importantly, helps nurses in choosing to practice in remote communities understand the deep value that the Government of Canada places on their work and on their commitment to these communities that so desperately need to ensure continuity of care. I also hope that it'll encourage more nurses to apply for this very unique and rewarding experience of working in remote communities. You know, many of the Indigenous Service Canada nurses that I've met in my travels talk about how rewarding this work really is, and that it is like no other work, in that the relationships that they form with communities and individuals in those communities are truly unique and very, very fulfilling. So recruiting as well as retaining nurses for these posts is so important. As I said earlier, Indigenous people across the country need to be able to access healthcare supports and services that they need in their communities, and it's a critical component of healthier communities. That's also why we're going to continue to work on modernizing the practice environment, making sure the well-being of our workforce is intact, supporting workers and indeed nurses to have the things and the supports that they need to practice well and in the most modern way, and to ensure that we remain nimble in our approaches to pressures, no matter what they may be and how they arise. On that note, I will say that nurses have proven time and again that their contributions to healthy communities and healthy patients are nothing short of heroic and certainly ingenuous. Their excellence in leadership and their nursing practices have played such a significant role in community well-being. And I want them and all nurses across this country to know that we are incredibly grateful for how hard and how creatively they've worked in a time where resources have been stretched, most particularly human resources, and that their commitment has certainly been noticed by the Government of Canada. So to these nurses, our gratitude and appreciation is endless. Thank you for your work. Miigwech, merci.
Minister Fortier.
Kwekwe, good morning, everyone. Bonjour tout le monde. I'm also honored to join my friend and colleague, Minister Patty Hajdu, also the president of the Professional Institute of the Public Service of Canada, Jennifer Carr. Thank you for being here. and Leila Gillis, Deputy Chief Nursing Officer at Indigenous Services Canada. Nice to meet you for this very important announcement. And before I continue, I'd like to acknowledge that I'm speaking to you from my office in Ottawa on the traditional unceded territory of the Algonquin Anishinaabe people. I'm very pleased to announce that the Government of Canada has reached an agreement with the Professional Institute of the Public Service of Canada to temporarily triple the recruitment and retention incentives offered to both full and part-time Indigenous Services Canada nurses who provide critical services in remote and isolated First Nations communities. These temporary changes, as Minister Hajdu mentioned, will come into effect on September 1st. Et j'ai vraiment le plaisir d'annoncer que le gouvernement du Canada a conclu cette entente avec l'Institut professionnel de la fonction publique du Canada afin de tripler temporairement les incitatifs au recrutement et au maintien en poste offerts aux infirmières et infirmiers à temps plein et à temps partiel des services aux Autochtones Canada qui fournissent des services essentiels dans les communautés éloignées et isolées des Premières Nations. Et ces changements temporaires entreront en vigueur le 1er septembre. These increases go hand in hand with other steps being taken by Indigenous Services Canada to respond to nursing shortages and will help stabilize critical nursing services in remote and isolated First Nation communities. And as we know, Canadians are well aware of the pressure being placed on healthcare delivery across the country, with frontline workers taking on incredible burdens. And the Government of Canada recognizes the impact that staffing challenges at health centers and nursing stations have had on First Nation communities in remote and isolated areas. These increases will enable Indigenous Services Canada to help address long-standing challenges with the recruitment and retention of nurses working in remote and rural communities. And these increases may also help encourage nurses to consider working in these communities, leading to an expanded skill set and a greater understanding of the health and well-being issues facing First Nations. The Treasury Board Secretariat is pleased to have worked collaboratively with Indigenous Services Canada and the Professional Institute of the Public Service of Canada to help bring about these changes. And I want to thank the leadership of everyone that got to this understanding. Thank you very much. Alors, le Conseil du Trésor est heureux d'avoir travaillé en collaboration avec Services aux Autochtones Canada et l'Institut professionnel de la fonction publique du Canada pour contribuer à la réalisation de ces changements et je remercie tous ceux et celles qui ont contribué à arriver à cette entente. And in addition to ensuring the effective delivery of vital government services, these increases reflect our commitment to working productively with unions. And I'd like to thank again all the incredibly talented and caring nurses at Indigenous Services Canada who on a daily basis provide critical health services in remote and isolated First Nations communities across the country. Alors pour terminer, j'aimerais remercier encore une fois tout le personnel infirmier qui sont talentueux et attentionnés de services aux Autochtones Canada qui au quotidien continuent de fournir des services de santé essentiels à un si grand nombre de personnes dans les communautés éloignées et isolées des Premières Nations. Their ongoing efforts to deliver culturally safe healthcare have a positive impact on people's lives in First Nation communities across the country, and I'm proud to recognize their important work with this announcement today. Alors, je vous remercie. Thank you. Miigwech.
Thank you. Next up is Jennifer Carr from PIPS.
Thank you. Good morning. My name is Jennifer Carr, and I am proud to be the president of the Professional Institute of the Public Service of Canada. I come to you today on the traditional unceded territory of the Algonquin Anishinaabe people, and I am honored to work and live on this land. I'd like to thank the ministers Hajdu and Fortier for the opportunity to join them today for this very important announcement. The Professional Institute represents 4,300 frontline healthcare workers across Canada in many professions that provide care in the diverse settings, including some 500 ISC nurses who serve remote Indigenous communities across the country. I'm glad that Indigenous Services Canada has implemented and improved these financial incentives, including part-time workers. Many provinces have already introduced similar measures. It is something that we have been advocating for since the start of the pandemic, and I'd like to thank the ministers for their efforts in introducing these incentives. Nevertheless, the staffing situation and employment conditions for healthcare professionals serving remote Indigenous communities across Canada is in crisis and will remain so unless much more is done. Our healthcare professionals in these communities face very real, significant workload issues, and recruitment and retention issues just add to that problem. For example, right now in Manitoba, there's a 60% vacancy rate in staffing of these positions. It's simply not that easy to find qualified candidates willing to accept the tough work, the distances and the travel involved, the potential for accidents on the way to and from these communities, and the health and safety risks that occur far away from their homes. Our members have worked all out since the beginning of the pandemic to help residents of these remote communities, and they cherish this work. This work cannot be done and cannot be performed from home. It has taken a tremendous toll on their physical and mental health, on their overall morale and well-being. They provide such an important service, and yet sometimes they arrive in communities with no running or hot water or scheduled periods without electricity. They are providing care in the most difficult of circumstances. We are glad to see this positive first step in addressing some of the issues they are facing, but it is only a first step. Decisive and immediate action must be taken to address these problems on a permanent basis. Much more needs to be done to address this crisis, not only to make these positions more attractive to potential candidates, but also to make sure that our fellow Canadians who live in these remote communities have access to the best possible healthcare services. The solution lies in fair compensation in line with that of their provincial counterparts, more flexible work arrangements, and enhanced technology infrastructure to support healthcare practitioners in remote areas. We realize that using private sector resources can help alleviate staffing shortages and provide some of these services on a temporary basis. But the government incurs enormous costs in doing that. And there is no doubt that it would be far cheaper and more effective to invest in a fully funded, permanent public sector solution. We must do better from here on. Let's make sure that all Canadians, no matter where they live, First Nation communities, receive the programs and services they depend on. Thank you, miigwech.
Thank you. And our last speaker is Leila Gillis, Deputy Chief Nursing Officer. Ms. Gillis.
Bonjour, hello. I am Leila Gillis, and it is my honor to join Minister Hajdu, Madame Fortier, and Madame Carr today, representing Indigenous Services Canada and its 840 nurses as the Deputy Chief Nursing Officer for Indigenous Services Canada for this important announcement. I first want to acknowledge that I am joining you virtually this morning from Ottawa, Ontario, the traditional territory of the Algonquin and Anishinaabe peoples, and I acknowledge the traditional territories across this land where nurses practice every day. I have been a registered nurse for 32 years and know that professional nursing holds a unique place in the world's healthcare infrastructure. Nurses are the largest human resource in the healthcare system. And at Indigenous Services Canada, they are the core of our health service delivery. We've seen over the past 2.5 years that the impact nurses have had on the safety and well-being of Indigenous communities and the Canadian healthcare system writ large has been immeasurable. Without nurses, we do not have a healthcare system at all. And that's why Indigenous Services Canada has worked with nurses and other health professionals across the country over the past year on a new approach to health human resource planning. The department has developed and is implementing a nursing health human resources framework that responds to the current and future needs of the populations we serve and is the cornerstone of ensuring the well-being and sustainability of our nursing workforce for years to come. The framework, with its 5 core commitments, provides the foundation and direction for retaining and recruiting nurse employees at Indigenous Services. Through the framework, Indigenous Services Canada commits to modernize the practice environment, to ensure the well-being of our workforce, to influence the labor market, to respond with nimble surge and relief resources. And our announcement today falls under our primary commitment to talent acquisition and management, specifically focusing on the remote and isolated communities where we provide direct service delivery. Our framework aims to comprehensively address retention and recruitment issues, of which remuneration is just one, albeit an important one. These increases to our existing recruitment and retention allowances provides an additional tool within our framework to keep the nurses we have and encourage nurses to join our incredible team in one of the most challenging and rewarding nursing roles in this country, where every day is a new opportunity to grow personally and professionally. For all those nurses who may be listening today, come nurse up north with Indigenous Services Canada. Come for the experience, stay for the people, and you will enjoy the rewards. Miigwech, thank you, merci, and stay well.
Thank you. It's now time for questions. If you would like to ask a question, please use the raised hand function. La première question, ça va au Michel Sabat de la Presse canadienne.
Oui, bonjour. Alors, for the remote community in Quebec, how many nurses do you hope can be recruited with what you're announcing? And are we talking about Nunavik?
Maybe Leila, you could take the question.
For sure, I'd be happy to. We are looking, we have, I'd say, a goal of, we have vacancies to fill up to 150 nursing positions. So that is, our ultimate goal within our recruitment strategy. And no, at this point, it does not include Nunavik.
Oh, merci. Ma question suivante est pour Mona Fortier. C'est un 2 pour 1, Madame Fortier. Donc, d'abord, le gouvernement fédéral écarte-t-il l'idée d'accorder une exemption à l'exigence de bilinguisme à ses employés qui parlent une langue autochtone, mais qui ne maîtrisent pas l'anglais ou le français? Et d'autre part, êtes-vous en faveur d'étendre le boni annuel de 800 $ remis aux employés bilingues à ceux qui parlent une langue autochtone?
Bonjour Michel, merci beaucoup pour ta question et je veux également remercier tous ceux et celles qui sont en ligne ce matin. Alors, vous savez que nous sommes résolus à fournir des services fédéraux conformément à nos obligations en matière de langues officielles et nous, évidemment, travaillons présentement à un nouveau cadre de formation en langue seconde pour la fonction publique qui répond aux besoins de tous les Autochtones, de tous les apprenants, y compris les besoins particuliers des Autochtones et également des personnes en situation de handicap. Et nous allons continuer à veiller à ce que les postes de la fonction publique soient identifiés bilingues lorsqu'il y a lieu et que ce soit fait à un niveau approprié de bilinguisme. Et ceci est essentiel, évidemment, pour maintenir un milieu de travail qui encourage l'utilisation des 2 langues officielles. Et nous sommes fermement engagés à protéger et à promouvoir nos 2 langues officielles. Présentement, nous continuons à explorer et s'assurer de travailler avec les fonctionnaires autochtones pour qu'ils puissent évidemment servir les Canadiens et les Canadiennes dans une des 2 langues officielles qu'ils connaissent, ou les 2, pour ceux qui connaissent les 2. Alors, nous allons continuer à travailler avec le réseau des employés des fonctionnaires autochtones et les autres départements et évidemment pour que l'on puisse s'assurer de servir les Canadiens dans les 2 langues officielles.
Merci. Next question goes to Dylan Robertson from the Winnipeg Free Press.
Hi there. Thanks so much for taking our questions today. Ms. Carr and Ms. Gillis, I'd like to hear from you both on this one. Have nurses in Manitoba reserves been leaving for other jobs, and is that in nursing elsewhere or an entire other career path? And on what kind of scale are we talking about? Because I'm just trying to understand how this short staffing has happened on the reserves and where these people went?
Dylan, thank you for your question. So this is something that is preoccupying the Professional Institute for sure, because we are seeing, like I said, an increase in contracting out of nursing services, and that's because they have been unable to recruit and retain the nurses that they have at the moment. From what we can see, some of these nurses are actually switching to agency nursing, where they can have the flexibility that they require, they can have the family life balance, and they can actually be compensated on a fair scale. One of the things that is not happening right now, or there is a shortfall, is some of our nurses are not being paid for their travel time to get to, or partial travel time to get to their remote stations, whereas an agency nurse is paid from the time they leave their house to the time they get into their communities. We have noticed, and this is not just ISC, but we've noticed that there's an increase in contracting out of government services, especially in the nursing area. And the government spent $97 million between 2019 and 2021 on contracted out nursing services, which actually is a 3.3% increase since the beginning of the pandemic. They're burnt out like their counterparts. Some are just leaving the profession in general. Some are taking their retirement. Like Leila said, that these are incredible nurses who have strong ties to their communities. They are proud to be public servants and to work and make better communities. But at some time when they are not feeling like they are being heard by their employer, they are choosing to leave the communities that they love and have served for very long. So thank you.
Yeah, and I will. I'd be happy to add to Jennifer's comments in that a part of our nursing health human resource framework is very much about communication and speaking to our workforce. And for those who do choose to leave, we are very interested through exit interviews to understand the reasons for moving from specifically a remote and isolated work environment. It's a very demanding role for sure, and it's one that we want to help understand. Help our nurses and better understand the rationale for when they choose to leave. A lot of our nurses, we attract nurses sometimes at the beginning of their career and also towards the end of their career. So demographically, we do have a number of nurses who are more on the end of their career. So at times we do lose nurses as within the larger nursing workforce because they are very near retirement and are retiring as well. So we're kind of looking at that demographic and looking at the personas of individuals who successfully and flourish within the practice environment in remote and isolated communities. And part of our nursing health human resource framework is about going out and targeting those individuals. And that's why we're calling it a sourcing and acquisition framework. And that's what's new about our health human resource approach. It's about sourcing the individuals who are successful in working in our environment. Dylan, you asked about the skill sets we're looking for. It's a highly skilled role that we have in remote and isolated communities. We look for good, strong knowledge, skills, and clinical expertise. Often with experience working in intensive care and/or emergency rooms. So we do look for nurses who do have an element of experience already, but we offer a significant amount of training and onboarding to build new employees as well within the practice environment, so that they can be successful in working in remote and isolated communities.
Thank you. And Minister Hajdu, there were concerns with the quality of care in Norway House Cree Nation after a toddler was sent away from the nursing station and later died. Can you please update us on the internal investigation, and how do you assess the quality of care in remote nursing stations in general?
Well, thanks very much, Dylan. And I don't have the specifics of where that investigation is at, so I will turn to Leila again. And maybe, Leila, you can also speak about the assessment of quality of care and what we do to protect that quality of care in First Nations.
Certainly, I'd be happy to. Within our nursing stations, we do have essential services and quality items that we have reviewed on an annual basis. They're called essential service assessments. When it comes to any practice environment across the healthcare system, there are going to be issues that require investigation and from a quality improvement perspective. And so we do have an extensive patient safety investigation process at which we work very closely with First Nations that we serve and the communities where we practice to work side by side to review all of the steps within the system that could lead to any particular errors or outcomes that we wish to improve. So through a patient safety incident review, we would sit alongside community members and the practitioners involved and review very closely all of the steps from A to Z within the system and look at where we can improve. And then we make remediation plans and we act on them to assure that we improve the system on a continuous basis.
Thank you. Next question goes to Fraser Needham from APTN. Fraser? Okay, we will skip back then. Dylan Robertson has raised his hand again.
Actually, I just got unmuted, but can I come back?
Yes, yes, you can.
Okay, sorry. Yeah, I was just checking. So could you just kind of go back for me to how many nurses does Indigenous Services Canada employ across the country, and how many positions are you short as of today?
Go ahead, Leila.
Okay, for sure. We have nurses in a number of roles across the country, just to clarify that. In the front line, we have public health nurses. There are some home care nurses still remaining as public servants. We still have 2 hospitals in Manitoba where we employ a number of nurses. And we have nurses working in the 50 remote and isolated nursing stations where we still are responsible for the service. Collectively, that, along with, of course, our nursing management and infrastructure to support those nurses, we have approximately 840 nurses right now within Indigenous Services Canada as public servant employees. For the remote and isolated nursing stations, on a daily basis, our operating levels are around 230 nurses. And, as Jennifer outlined, we do have a significant vacancy rate right now. My estimates are, to address the immediate needs within nursing stations, we would require up to 150 nurses to fill the needs for our operations in the north.
Okay, well, I guess it's not maybe as bad as what I've heard for the province of Ontario. They're short 30,000 nurses totally provincially. So I guess what I've heard just listening to stories about this, I haven't done any personally, but I've been following, is that there is a massive nursing shortage of terms of graduates across the country. That there's been a lot of people have left the profession due to COVID, and then retirements just of aging and things. And so that our educational systems and the country has not kept up with this. So now they have these massive shortages. So I'm just not sure how this particular retention program will help that if there aren't any nurses, I guess, to retain or recruit.
I mean, I could start, Leila, and then maybe you can talk about some of the specifics. Hi, Fraser. It's Patty. Hajdu. You're absolutely right. I mean, listen, we have a healthcare shortage across the country. That is clear. And I think, the analysis is still out about, I don't think it's any one thing. I mean, we've been talking about a declining population rate for a very long time as a country. Economists have predicted this moment in time, and we seem to be here. But of course, COVID exacerbated the early retirement of many people who maybe would have stuck around a little bit longer if, in fact, we weren't faced with the kinds of extreme demands placed on healthcare workers during the pandemic. And I think, in general, the challenge for retention and recruitment in, further away from urban centers has always been real. As I said in my remarks, I come from Northern Ontario. We've been talking about a doctor and nursing shortage and other healthcare professionals for decades, if you will. It's part of why, for example, we have now the Northern Ontario School of Medicine as part of the recruitment and efforts to keep people trained, keep training opportunities closer to home, for example, to diversify the way that professionals are trained. And I think it's going to be an all hands on deck effort to ensure that we have the right people to do these jobs going forward across the country. And it will include not just the efforts we're announcing today, which is about trying to make sure that we have the best and the brightest, and also that we can retain the people that are already working in remote communities, because it is an additional strain on people that are not from that community to have to fly in, stay in those communities. We want to acknowledge the sacrifice that people make in performing these duties that are often far from home. But I think also, the efforts that Indigenous Services Canada is making on education and on training, and on making sure that we recruit young Indigenous people, which, by the way, are a growing population in Canada, to be able to access the kinds of supports they need to pursue education and potentially practice it closer to home. In my own riding, admittedly, none of them would be considered remote. I've seen some of this rejuvenation of communities based on young people from those communities gaining skills and education, coming back to be the teachers and the healthcare providers and the tradespeople that communities need to be able to prosper and grow. So it's not one solution. It really is multiple solutions that will, create a longer term, more stable healthcare workforce in particular. But I think today's announcement is about recognizing just how precious and valuable those services are in the context of remote communities, and doing everything we can to keep those people that have chosen to practice in remote communities, and to entice new people to, as Leila says, experience just how wonderful it is to work in these communities and to get to know people in these communities, and to be able to have that rich nursing experience that you really might not be able to experience anywhere else in the country.
Yeah, I'd be happy to add to that. I believe in 2019, the growth rate for registered nurses was only around 1.5%. Nurse practitioners was a little over 8%, though, which is exciting for us because that is an area within our nursing cadre that we're looking to increase over the next few years. A crisis like this in the Canadian healthcare system requires multi-jurisdictional collaboration in regards to finding solutions. And a part of that, as you raise, is about building the nursing workforce over time. I know that jurisdictions such as British Columbia have significantly increased the number of registered nursing seats within their universities in response to that. And in Indigenous Services Canada, I mentioned within our talent management framework, a part of that is about influencing the labor market. And that's important for us to work with our colleagues within the Canadian Association of Schools of Nursing and with our provincial and territorial colleagues about building the nursing workforce of the future, but also supporting the existing workforce in a positive way. Through our anti-Indigenous racism initiatives within Indigenous Services Canada, we are supporting some innovations such as an Indigenous practical nursing program that's happening across in a couple of our jurisdictions. And so we are looking at innovations and different types of ways to also increase the number of Indigenous healthcare workers in the healthcare system, including Indigenous nurses. So, I think over time, it's about building the health human resources of the future, and it's about collaboration across the multiple jurisdictions.
And if I can just add on to that, we really do need to actually look at nurses that have left the profession. I'm going to quote my friends over at ONA. There are 15,000 registered nurses right now who are not practicing, and that has to be looked into because there are people who have left the profession because they have felt burnt out, stressed out. They're not feeling love from their employer, and we really have to get to those root causes. I don't think there is so much of a shortfall of nurses right now. It's nurses not wanting to work under the conditions that they have been placed under for the last couple of years, and I think it's really important. And again, thank you, Leila, for bringing up the registered nurse practitioners, because the government does not have a classification yet for nurse practitioners. So I would really like the government of Canada to look into providing that recognition for that practitioner at the federal level. So thank you.
Okay, next question, Dylan Robertson again.
Hi, thanks again. A question for Ms. Carr and possibly Ms. Gillis. Do you have any comparison of what the wages for the public system provincial nurses in Ontario and Manitoba, just given the pay concerns that we've heard on the provincial level and the fact that this is the two provinces with the most nursing stations? How do they compare with the public ones, and how does that compare with the agency wages?
So I'll start. I can't give you the actual costs. I'll have to go back to my negotiator. I know that they do have them. But in terms of looking at what an agency nurse does, compared to an ISC nurse and an Indigenous Service Canada nurse, it pales in comparison. And they are being compensated, I think, almost 3 times as much. One of my colleagues pointed out that an agency nurse being recruited for Nuvik was actually being paid $300 an hour. So that's quite a inflated amount that the government of Canada is paying for these services, and provincial counterparts are paying for these services that do belong within the public healthcare system. And also an agency nurse, doesn't have that tie to the community, that commitment to the community, and is not building those bridges for which makes Indigenous service nursing so rewarding for our members. I'd also like to point out that while they are nurses, in these communities, they are the sole healthcare provider. So they're the psychologist, the social worker, they're the ambulance, they're the paramedic. They have such a big breadth and scope within their work. And I think that all needs to be recognized in their compensation package. So it's very unfair to, I would say it would be unfair to compare them to a nurse working in a hospital setting, because their role and responsibilities are quite different.
Yeah, and I'd happily add to that, Jennifer. Thanks very much for that comment. And, I don't have the specifics of every jurisdiction right in front of me, but, we work very, very closely with our colleagues at the Treasury Board Secretariat as the employer of the nurses to, complete wage studies over time and to assure that the Government of Canada has competitive salaries. We do have a, certainly competitive pension plan and benefits that is some of the best in the country. As I mentioned, our intention is to build our public service nursing workforce. Privatization is not ideal within and using the public sector, the private sector nurses is very much about meeting the needs of the community and assuring that we have services available. But our intention is to build the workforce within the public service. Because as you say, Jennifer, these nurses are not comparable to a temporary contractor, and I think that it's our intention certainly to build our workforce, and part of that is about competitive remuneration. These allowances today certainly bring us so much closer and perhaps even more competitive than some other jurisdictions. And so, we're really excited to make that as part of another tool in our toolkit for attracting and retaining the staff that we have in remote and isolated communities, but also within Indigenous communities across the country.
Thank you. And Minister Hajdu, this money is going towards wage bump ups instead of healthcare transformation or devolution projects. Can you please walk us through how you balance operating the existing system and meeting the demands of communities that want more autonomy?
Well, Dylan, it's not an either or, as your question a little bit implied. It really is an and. This is an urgent step that we're taking to provide and hopefully secure some stability for nursing and nursing care in remote communities. But there is also system transformation happening across the country, including, as you know, the consultations ongoing about co-developed health legislation legislation as we get a better understanding of the roles that communities want to play in delivering healthcare and how that looks across the country. And it is different across the country. I look at the First Nations Health Authority in BC, for example, where healthcare has been devolved to the care and control of First Nations-led organizations, and that provides healthcare in a vast diversity of settings and vast diversity of services. And then the challenges that we see in Ontario and in Manitoba that are completely different. And so this is part of that transformation. It's an urgent step because of the challenges that we're seeing in terms of retention and recruitment, and given the climate that we're in. But in fact, that work of transforming the system is happening now in partnership with Indigenous peoples and First Nations. Maybe, Leila, you can speak a little bit more about some of the activities that have been happening in that space.
Apologies. Absolutely, Minister. It isn't an either or, it is an and. The raison d'etre for our entire nursing health human resource framework is about stabilizing the services that we still directly deliver as Indigenous Services Canada, so as to assure that they are in quality and top shape for devolution and for the ownership and control of the First Nations that we will eventually work with to take on those remaining services that are in remote and isolated communities. So it is about assuring that we have stabilized and have public servants who are in place and delivering, so that we can then work with our communities to over time negotiate and to devolve those services. And so I think that it is certainly not a either or. It is in fact a part of the pathway to devolution, and health transformation is about stabilizing the existing services and providing a service that is in good shape for communities to be able to take on that ownership and control.
Prochaine question, Emily Bergeron, La Presse Canadienne.
Oui, bonjour. I'll ask my question in English because I don't know who can better answer it. If I understood well, one of the previous answers that were given to a question, the remote community in Quebec that is entitled with this agreement announced, it does not include Nunavik. So I'm just trying to figure out what region of Quebec is concerned by this announcement?
Merci pour la question. La communauté est Lac Rapide, qui est la communauté qui... sorry, I've got translation at the same time. One moment here. There we go. La communauté qui vont bénéficier de cette annonce est Lac Rapide. Leila, would you like to add some more?
Okay, and is there any estimates of the number of nurses that you wish to recruit with this announcement in Lac Rapide?
Leila, c'est pour vous.
No problem. I'm actually looking right now. Our actual operational levels at Lac Rapide are 3 nurses. So it is a small cadre of nurses that we still have within the province of Quebec. And in fact, it's a great example of health transformation and First Nation ownership and control in the province of Quebec, because the majority of our nursing stations have been under First Nation ownership and control for many, many years. So we just have, just over the last couple of years, we did devolve another nursing station in Quebec successfully, and I think we're on the path towards doing that in partnership with the community of Lac Rapide over time. But that community has 3 nurses as our operational levels. So I don't have the exact vacancy rate for that particular nursing station right now, but we are constantly recruiting in partnership with our operational office in Quebec in regards to identifying their needs and sourcing the nurses that they require.
Okay, next question goes to Fraser Needham from APTN again. And Fraser, you may have to unmute yourself. I just had to mute you because you popped up on the screen.
Oh, yeah, no problem. Yeah, just a couple of quick technical questions, I guess. So the first one is, how much total money has the federal government set aside for this initiative?
I don't have that number, Fraser. If someone else does, please feel free to jump in. If not, we'll get you the anticipated.
Yeah, I think that for the remainder of this fiscal year, we've estimated that the increases to the allowances will equate to approximately $750,000 to $800,000 in increases.
Okay, and then if I was looking at the chart of, I happened to, one of your nice ISC colleagues sent me the press release. So I was looking at the different numbers. And so my understanding is there's there's a retention allowance, there's a recruitment, and also there's just not a general allowance. So just quickly crunching this, it looks like it could be as much as $20,000 extra per year in allowances for one employee. Is that correct?
I think that's, unless someone wants to correct me, I think that is likely correct if the person was starting that year and completed the full 12 months. So just to be clear, there's an initial recruitment allowance that's tripled. Then there's a allowance provided after 12 months of employment. So that would be largely focused on retention. And then there's an annual allowance as well each year. So Leila, you'll have to clarify whether those two retention allowances are simultaneous.
Well, compensation is a complicated world within our nursing. So for full-time annualized amounts, the recruitment allowance is in the first month of hire. And then the second component of that recruitment allowance is after the first 12 months of employment. And then, of course, the annual retention allowance is every year after that, of up to at full-time of $16,500.
Okay, are there any other questions? Y a-t-il d'autres questions? Going once, going twice? Thank you very much. This ends this press conference.
Merci
Thank
beaucoup
you,
tout le
everybody.
monde. Bonne journée.
Merci.
Nice to see you all. Bye-bye.
Great, thank you very much.